Greetings, loved ones. Munchausen syndrome, or factitious disorder, is a serious mental disorder in which someone deceives others by appearing sick, by purposely getting sick, or by self-injury. Factitious disorder also can happen when family members or caregivers falsely present others, such as children, as being ill, injured, or impaired. Today we're going to talk about Munchausen syndrome, or as its new name, more frequently used by authorities, factitious disorder. Help us get these messages out. Please subscribe to our channel. Follow us on Facebook, Instagram, and Twitter. Hit that like button and the notification bell, and please share these messages with others. You could save a life. So let's begin today with a definition of Munchausen syndrome, or factitious disorder. Factitious disorder is a serious mental disorder in which someone deceives others by appearing sick, by purposely getting sick, or by self-injury. Factitious disorder also can happen when family members or caregivers falsely present others, such as children, as being ill, injured, or impaired. Factitious disorder symptoms can range from mild, slight exaggeration of symptoms, to severe, previously called Munchausen syndrome. The person may make up symptoms or even tamper with medical tests to convince others that treatment such as high-risk surgery is needed. Factitious disorder is not the same as inventing medical problems for practical benefits, such as getting out of work or winning a lawsuit. Although people with factitious disorder know they are causing their symptoms or illnesses, they may not understand the reasons for their behaviors or recognize themselves as having a problem. Factitious disorder is challenging to identify, and it is hard to treat. However, medical and psychiatric help are critical for preventing serious injury and even death caused by the self-harm typical of this disorder. Today we're going to focus on Munchausen by proxy, or factitious disorder by proxy, which is when an adult intentionally causes the child to become sick or injured in order for the caregiver to receive attention. Child victims of pediatric falsification syndrome, i.e. Munchausen syndrome by proxy, may present with a variety of symptoms. Common presentations of this uncommon syndrome are apnea, apparent life-threatening event, fevers, metabolic disturbances, rashes, seizures, sepsis, unusual bleeding reported in the child's emesis, urine, stool, or sputum, vomiting. The perpetrator is most often the mother. It usually takes several interactions with the healthcare system for medical providers to suspect the mother is fabricating or causing the symptoms. Once suspected, the diagnosis may be difficult to confirm. And before going forward, I want to insert something here. The perpetrators of this will often go to different doctors so that no one doctor sees the entire history, in order to avoid being caught. So let's talk about signs and symptoms of child abuse. Bruises that are highly suspicious for child abuse include the following areas: abdomen, bruised with a pattern, cheeks, chest, ears, genital or anal areas, inner surfaces of arms and legs, and the neck. And the following types of burns in young children may indicate abuse, such as contact burns showing the shape of an object like an iron or cigarettes, full thickness burns, immersion burns with a stocking glove pattern where hands are immersed in boiling water. The following types of fractures are often caused by abuse: fracture in a non-ambulatory child, fracture inconsistent with the history provided, metaphyseal fractures, i.e. a corner, a chip, or bucket handle fracture, rib fractures, scapular fractures, sternum fractures, vertebral body fractures. There are also several types of head, eye, ears, nose, and throat injuries, such as cuts or bruises in the mouth in a child with no teeth, frenulum tears, intracranial injury without a history of significant trauma or period of hypoxia, retinal hemorrhages, skull fracture from a short distance or low velocity fall, and subdural hematomas. Then there are internal organ injuries in the absence of a high-velocity injury or long-distance fall that may indicate abuse, such as duodenal hematoma, esophageal or pharyngeal tear, liver laceration, mesenteric tear, pancreatic injury, pulmonary contusion, splenic laceration. I know, lots of big words. In shaken baby syndrome, the examiner may see some or all of the following: an intracranial injury, usually a subdural hematoma, metaphyseal fractures, retinal hemorrhages, and rib fractures. In cases of suspected child abuse, a complete physical examination should focus attention on the oropharynx, posterior aurelilar areas, inner surfaces of extremities, external anal and genital areas. The cause of child abuse is not completely understood. Sleep-deprived and stressed caretakers, especially those with the risk factors outlined previously, may hurt the infant or child. Mothers, boyfriends, and fathers are the most common aggressors of child abuse, followed by other caretakers. It is unknown why some fatigued caretakers recognize their frustration with the infant or child and remain in control, while others lose control and injure the child. According to the CDC, over half of all children in the world, that's 1 billion children ages 2 to 17, experience violence every year. The question is not if you encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. Micah 6:8 says, He has showed you, O man, what is good. And what does the Lord require of you? To do justice, love mercy, and walk humbly with your God. We are all called to be champions for justice. In our next episode, we're going to discuss and begin a series talking about how to care for children who have been abused. Until then, God bless you.